Welcome to Exposé. It's a joy to be with you today again. I'm your regular host, Tony Akinyemi. We started this series on cardiovascular diseases in general and hypertension in particular. So we call this Hypertension Part 2. There are things that we need to know, there are things that we need to understand, and that will equip us to know exactly how to ward off these marauders called cardiovascular diseases. I signed off in part 1 by making a concluding statement that most of these cardiovascular diseases are largely preventable and very much reversible. And that, to me, is good news. We have started by stating the problem, and subsequently we shall be stating the solution. Today we continue with our understanding of the problem. We have looked at several types of cardiovascular diseases, and today we'll be looking at hypertension in particular, or high blood pressure. Now, there are 3 scenarios that a person's blood pressure can assume. The blood pressure can be too high, or too low, or normal. Those are the 3 scenarios. If a person's blood pressure is too high, that is called hypertension. If a person's blood pressure is too low, that's called hypotension. If a person's blood pressure is normal, that's called normotension. So you can either have hypertension, hypotension, or normotension. My prayer for you is that your blood pressure will always be normal. Because when it is too high, there are implications, and it can lead to complications. When it is too low as well, it also has its own implications and can lead to complications. So normal blood pressure is our goal. But we are zeroing in on high blood pressure or hypertension. Let me begin today by looking at different types of hypertension. Many of us who are lay people may not be aware that there are different types of hypertension. So if you find 10 people who are hypertensive or who are dealing with hypertension, it does not mean that all 10 of them have the same type of hypertension. There are at least 8 different types, or 7 major ones, but probably 8 different types of hypertension. And that's why I personally believe that when it comes to treatment, when it comes to intervention, when it comes to addressing hypertension, one size does not fit all. Each person's case has to be addressed on its own merit. That is how to get good outcomes or good results. If you use the same solution for everybody across board, some will get well, some will not get well, because there are different types of hypertension. So let me begin by highlighting at least 7 of the major types of hypertension out there. Okay? Broadly speaking, there is what we call primary hypertension and secondary hypertension. Those are the 2 major broad types of hypertension. Primary hypertension is also referred to as essential hypertension. Up to today, I'm still wondering why it is called essential hypertension. I don't know. Maybe some people out there know. But primary hypertension is also called essential hypertension. Then secondary hypertension is another type of hypertension that is due to something else that is primary. We are going to be looking at each of these in greater details. So those are 2 out of the 7 or 8 major types of hypertension. Other types of hypertension include what we call malignant hypertension. Again, we are going to look at each one of them in details to understand what they are. The 4th one is called isolated systolic hypertension. Again, we will understand what that means very shortly. Number 5 is called white coat hypertension. I call that nervous hypertension, white coat hypertension. Why is it called white coat hypertension? You are going to understand very shortly. Number 6 is called resistant hypertension. Again, why is it known as resistant hypertension? We're going to look at that as time goes on. And then we have postural hypertension or orthostatic hypertension. That's another type of hypertension. Or I really prefer to call that one hypotension, because typically what happens is when you change your posture, your blood pressure also changes because of the sudden change of posture. And usually what happens is it drops. It goes too low. When you stand up suddenly, for example, that's called postural hypotension or orthostatic hypotension. We're going to be looking at each one of them in greater detail. So let's begin with primary hypertension. Now, it is by far the most common type of hypertension that you are going to find out there among people who are hypertensive. Statistics reveals that approximately 95% of those who are hypertensive actually have primary hypertension or essential hypertension. Now, medical science usually says that the cause for essential hypertension or primary hypertension is unknown. They will use the phrase etiology unknown. In medical language, etiology means the cause of disease. The cause of disease is known as etiology. The British English, we spell it as A-E-T-I-O-L-O-G-Y. But American English will eliminate the A and begin with the E. They will spell it as E-T-I-O-L-O-G-Y, etiology. They are pronounced the same way, but the spelling is different from British English to the American English. So whichever way you like to spell it, it is etiology, and it means the cause of disease. So when it comes to primary hypertension or essential hypertension, medical science will say etiology unknown. In other words, we don't know the cause. Medical science also says that primary hypertension or essential hypertension is incurable, but it is manageable. In other words, it can be successfully managed. A person can have primary hypertension or essential hypertension, and medical science says they cannot reverse it, but we can give them medication to keep their blood pressure under control for as long as possible, maybe 20 years, maybe 30 years, maybe 40 years, so that they can help that individual to successfully cohabit with their disease, and the disease will not be allowed to kill them prematurely. They too are not allowed to sack the disease. They have a marriage of convenience where the disease is the husband and the patient is the wife, and the wife must provide cook breakfast, lunch, and supper for the husband in the form of 1 tablet in the morning, 1 tablet in the afternoon, 1 tablet in the evening to keep blood pressure normal. That's primary hypertension or essential hypertension. That is the opinion of medical science, but that is not necessarily the gospel. I believe otherwise. I have seen a number of people with essential hypertension whose blood pressure have now become normalized by dietary and lifestyle adjustments as well as faith in God. I do believe that if you have primary hypertension, you can reverse it. I mentioned the name of some great doctors: Dr. Dean Ornish, Dr. Elsa Swin, Dr. John McDougall, Dr. Steven Sinatra, and my humble self. I am not a doctor, I am a nutritionist. We have worked with people, and many other scientists and healthcare providers around the world are doing the same. They are working with people with essential hypertension, and they are helping them to reverse their hypertension so they can ultimately be weaned off their medications, and they can live the rest of their lives with normal blood pressure without medication. I believe that what we need is not more medication, but more education. And the best prescription is knowledge. So we move on to the second type of hypertension today. That is what is called secondary hypertension. Secondary hypertension. As the name depicts, secondary hypertension means that the elevated blood pressure is only a symptom of another underlying condition. If that underlying condition is corrected, the blood pressure will drop and come back to normal. That's why it is called secondary hypertension. So in that case, you are not treating the elevated blood pressure, but you are identifying what is making the blood pressure to go up, and then you treat that particular underlying root factor. Once you correct that factor, the BP normalizes. I'll mention a few of the underlying factors that can give rise to secondary hypertension. One is thyroid dysfunction. The thyroid is a small gland at the base of the neck, somewhere here. It's like a butterfly. It has a wing on this side, a wing on this side, and it's connected in the middle here. If there is thyroid dysfunction, many things in our physiology can be upset. Many things about the way our body functions can be upset. It can affect our metabolism if there's thyroid disorder. It can affect our weight gain or weight loss. It can affect even the regulation of our body temperature. It can affect even fertility. It can affect even our eyes and our vision. It can affect virtually every system in the body when there is thyroid dysfunction. And that is one of the things that can make blood pressure to go up, which is called secondary hypertension. Another thing that can lead to secondary hypertension is kidney impairment. When the kidneys are malfunctioning or there is a dysfunction in the kidney, when there is any damage to the kidney, that will affect your BP. When kidney impairment takes place, normally blood pressure goes up, and then blood level goes down. So PCV goes down, BP goes up, creatinine and urea will go up when there is kidney impairment. So kidney disease can lead to secondary hypertension. And then, of course, there is what we call pregnancy-induced hypertension. Some people, their BP will go up when they are pregnant, some women. As soon as they deliver the baby, the BP comes down. Okay, there's a condition, for example, that they call preeclampsia, and that can cause problems for pregnant women, BP-related during pregnancy. Then we also have sleep apnea syndrome, which is another thing that can make blood pressure to go up, to cause secondary hypertension. How do I describe sleep apnea? I call it postgraduate snoring. When somebody sleeps and he snores. Some people snore so much that everybody in the apartment, everybody in the neighboring apartments, we know that somebody is sleeping in that house. I call that postgraduate snoring. They snore so heavily that people can hear from 3 houses away, 4 houses away. When they travel and they are not home, everybody knows that they have traveled because the trumpet doesn't blow through the night anymore. That is, now, when people snore that way, you say there's a way they snore, and they will momentarily stop breathing at a point, and then they will start suddenly again. It's like, grrr, 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 grrr. If you see people snoring like that, that is called sleep apnea. Now, when people sleep like that and they snore through the night, what happens is that the amount of oxygen going into their blood is so low, by the time they wake up in the morning, they have very low oxygen level in their blood. When they put an oximeter on their finger to measure the amount of oxygen in their blood, it goes down so low. So when they wake up in the morning, because of the low oxygen level, because of the labored breathing, snoring through the night, what happens is that the body wants to quickly bring in more oxygen and compensate. So the heart begins to pump very heavily, and then BP goes up. Now, such people have elevated blood pressure usually when they wake up in the morning, when they have sleep apnea syndrome. As soon as they have been up for about 2 hours, 3 hours, and their blood oxygen level has come up, you see that their BP will come down. Normally, when people sleep and they get refreshed, their BP should normally go down a little lower. When they just wake up in the morning, when you are fresh, your BP normally should go down. It's when you are walking around during the day that your BP may go up a little bit. But for people who are having sleep apnea syndrome, their BP goes up when they wake up rather than go down. That's a secondary hypertension. So you are not going to be treating the elevated BP, you are going to be addressing the snoring, because that is the primary cause of the elevated BP. Then we have certain medications and certain recreational drugs that also cause elevated BP. That's secondary hypertension. Tumors, certain tumors, benign or malignant, can also elevate BP. Then overactivity of the adrenal glands. The adrenal glands are on top of the kidneys, tiny, tiny little things on top of the kidneys. They help us to cope with stress. They produce adrenaline, cortisol, the stress hormones. When there is overactivity of those glands, that can cause BP to go up. That is secondary. You know, the BP is secondary to the adrenal problem. Then there's coarctation, which is the narrowing of the aorta, okay? And that can also make blood pressure to go up due to plaque deposit. This is a good place to have a short break, and I'll be back and continue with the remaining types of hypertension. Don't go away. I believe you've been having a terrific time with me on Exposé with Tony Akinyemi. We have great resources that will bless your life available to you on healthy living and many other life subjects. We have various platforms where you can obtain materials for your blessing. You can obtain some of our work, our books, particularly on Amazon.com. How to Regain and Retain Your Health is a book title that I highly recommend. It's available in digital format, Kindle edition, as well as in printed version. We also have juices and smoothies for healing, health, and pleasure. You can also find these items at another website, familabooks.com, F-A-M-I-L-A books.com. And for those of you who are in Nigeria, you can reach us at the Shepherd Store, 18 Shogunle Street, off Mobolaji Bank Anthony Way, behind HFS Place, to get our materials. We have over 600 recorded audio CDs, DVDs, VCDs, and MP3s on various subjects. All these things that I teach on Exposé are already available in their complete format. How to reverse hypertension naturally, how to reverse diabetes naturally, how to reverse arthritis naturally, and many other wonderful titles. I encourage you to visit this website, Amazon.com, familabooks.com, or TSF bookstores in Ikeja, Lagos, Nigeria, and you will be blessed reading those materials and sharing them with your friends and family. Thank you once again. God bless you. You're welcome back. This is Exposé. I'm your regular host, Tony Akinyemi. We're dealing with hypertension. Today is part 2. And we are looking at the different types of hypertension. We have looked at primary hypertension or essential hypertension, and we have looked at secondary hypertension and the different underlying factors that can induce secondary hypertension. Thirdly, we're going to be looking at malignant hypertension. Of course, the word malignant does not mean cancerous. It does not mean that it is a tumor or something like that. It is called malignant because of the nature of it, okay? It is not caused by cancer, neither is it caused by any kind of malignancy. Now, it is the most severe but relatively rare form of hypertension. Malignant hypertension is the most severe form of hypertension, but thankfully, it's also a very rare form of it. It doesn't normally, you don't find it very commonly among people. It usually progressively gets worse if the right thing is not done, and it rapidly leads to organ damage, particularly kidney damage. Okay? Unless appropriately addressed, it could be fatal within 5 years of diagnosis for the majority of patients. Now, death usually occurs due to heart failure or kidney damage or brain hemorrhage, bleeding into the brain because of the excessive pressure in the blood vessels. Now, thankfully, this type of hypertension, as malignant as it is also reversible as well as preventable through diet and lifestyle adjustment as well as faith in God. The fourth type of hypertension is isolated systolic hypertension. Again, the name gives it away. Now, when a person's blood pressure is measured, there are usually 2 figures. There is an upper figure and a lower figure. The upper figure is called the systolic pressure. The lower figure is called the diastolic pressure. So a person's blood pressure can be 110/70 or 120/80. The 120 is the systolic pressure, and the 80 is the diastolic pressure. So what is systolic pressure? The heart pumps blood, boo, ba, boo, ba, boo, ba. Now when the heart pushes blood out of the heart into the blood vessel, push, the blood will rush from the heart into the blood vessel and exert a pressure on the blood, the wall of the blood vessel. That's the highest level of pressure. That's the systolic pressure. Then when the heart relaxes, the pressure reduces to its lowest level. That is diastolic. So systolic is the highest pressure, and diastolic is the lowest pressure. And usually a person's blood pressure, you take both the highest and the lowest, the systolic and the diastolic, and you make it 120 over 80 or 175 over 115 or something of that nature. Now, when somebody's blood pressure goes up, both figures may go up, or just one of the figures may go up. For some people, the lower figure, the diastolic pressure, remains normal, but the upper figure, the systolic pressure, is the one that goes high. So it is only the systolic pressure that is isolated and elevated. So that's called isolated systolic hypertension. In other words, the diastolic pressure is normal, but the systolic pressure is over the bar. So that's called isolated systolic hypertension. Now, the systolic pressure, like I said, is supposed to be below 140 ordinarily for a healthy person. At the very most, sometimes when one is under some kind of serious pressure, it shouldn't go above 160. If it goes above 160 or the diastolic goes above 90, then there's a serious problem. They have even, in fact, recently lowered the systolic from 140 to 130, even though I believe that depending on the person's age, if you can maintain your systolic below 140 and your diastolic below 90, then you are in good shape. Now, isolated systolic hypertension mostly occurs in older people, not younger people. Of course, some young people can also have it. Medical scientists say that it is usually due to the stiffening of the arteries. When the arteries become hard, it's no longer able to dilate and constrict easily. It loses its elasticity, and that makes it difficult to regulate. But I have seen that usually when a person has isolated systolic hypertension, it is usually due to stress or some psycho-emotional problems or anxiety, worry, fear, phobia, insomnia, sleeplessness. These are the things that, from my experience, these are the things that drive up the upper figure, the systolic pressure, okay? So if a person has normal diastolic, lower figure, and the upper figure is elevated, I want to look at the person's stress life. I want to look at the kind of job that the person is doing. I want to know what is going on in the mind of that person. I want to know what is going on in the life of that person, in that person's marriage, in that person's career, in that person's financial situation, in that person's ministry, in that person's business, in that person's academics. You see, when there are issues bothering a person, the person is thinking too much, the person is not able to sleep, the person is afraid, the person is undergoing a lot of stress, a lot of pressure, or is in a toxic relationship, all of these things can drive up the systolic pressure and can lead to isolated systolic hypertension. Such types of hypertension don't usually respond to chemical remedies. What such an individual needs is more of counseling, more of encouragement, more of support, and more of techniques to manage stress, to sleep better, to deal with conflicts, and the rest of them like that. Okay? Some scientists also believe that our Western lifestyle that we are imbibing, the Western lifestyle, diet and lifestyle that we're imbibing, could also be driving that particular type of hypertension. Appropriately addressing isolated systolic hypertension significantly reduces the incidence of stroke and heart disease. Stress management, lifestyle adjustment, dietary adjustment, and such things will typically help to address this type of hypertension. Number 5 type of hypertension is white coat hypertension. I told you the other time, you will understand what that means if you didn't know it before now. It simply means anxiety-induced hypertension. Imagine that you're not feeling fine in your body and then you decided to visit your doctor in the clinic, and you're in the doctor's office, and the doctor comes in with his white coat and with his stethoscope around his neck, and he has a file and a pen in his hand, and he says, "Yes, so how may we help you today?" And then you say, okay, sit down, let me check your BP. They begin to take your blood sample, your urine sample. They want to do investigation. They want to do lab tests to know what is wrong with you. You know, the thought of it alone begins to make you nervous. You see your BP going up. So if they check your BP at that time and your BP goes up when you're in an hospital environment, when you are nervous, or maybe you felt a particular symptom and they say, okay, let us screen you for HIV or let us screen you for COVID-19. They took your sample and they sent it to the lab for testing. Before the result comes out, you're already nervous. Your BP can go up. It doesn't mean you're hypertensive. It means that elevated BP is anxiety-driven. It is called white coat syndrome or white coat hypertension. When you see people in white coat, nurses, doctors, and medical professionals, you get nervous. You begin to sweat in your palms, and your BP goes up. You see that by the time you get home, you relax, and the BP normalizes. Or by the time the result of your test comes out and it's negative, you give a sigh of relief, and that hypertension is gone, okay? The sixth one is resistant hypertension. It's a situation in which blood pressure cannot be reduced to below 140/90 in spite of a triple drug regime or a triple drug therapy. They give you a vasodilator, they give you a diuretic, they give you a calcium channel blocker, all the different medications in different categories. By the way, we are going to be looking at how official medicine addresses hypertension, the cocktail of remedies and interventions. We will look at that. And then we'll look at natural approaches to lowering BP without those chemicals in your body. So when they use the three topmost medications in the arsenal of medical science to address a person's hypertension and it is still not coming down, that type is categorized as resistant hypertension. And then the seventh one that we'll be talking about today is postural hypertension or orthostatic hypertension. I explained that before. I am seated now. If I sit here for a while, usually senior citizens, people who are in their 60s, in their 70s, in their 80s, and so on, when they sit for a long time and then they get up suddenly, their blood pressure can just drop, zoom, and then you see the ground will begin to spin. They feel dizzy or they experience vertigo, okay, where the ground is spinning in front of them. They can even fall. That is due to a sudden drop, momentary drop in their BP. That BP will normalize within 1 or 2 minutes, and then they stabilize again. But during that short period that the BP dropped, they have dizziness or vertigo. And that is because of change in posture. That's why it is called postural hypotension or orthostatic hypertension. Now, all of these things are the different types of hypertension that people experience. We have explained also that hypotension means low blood pressure. What is low blood pressure? If the systolic pressure is below 90 or the diastolic is below 60, that's 90/60, anything below that is considered too low. And anything above 140/90 is considered too high. Okay? Then there is another one that is called postprandial hypotension. Now, when you hear postprandial in medical language, it simply means after a meal, after you just eating food. Anything that happens after that is called post-meal or postprandial. You can check your postprandial blood sugar 2 hours after eating. What is your blood sugar like? You see PP, postprandial, or postprandial hypotension. Some people, elderly people in particular, when they eat a big meal, see, almost all the blood in their body will migrate into the stomach to start waiting for the digested food to be absorbed, into the blood. And so there'll be less blood in the brain and less blood in other parts of the body. When they get up suddenly, after such a heavy meal, the ground can begin to spin and they can fall. And that's called postprandial hypotension, a sudden drop in blood pressure after a heavy meal when they get up suddenly. So elderly people need to watch how they get up, particularly when they've been sitting for long or lying for long or when they have just finished a meal. You do it in style, okay? You don't behave like children. You just jump up and start running. You stand up gently in grand style. That's why also when elderly people sleep at night and you wake up at night, you want to go to the bathroom, you want to go to the toilet to wee, When you get up, don't get up suddenly and start going towards the bathroom. First of all, get up and sit at the edge of your bed and wait for 30 seconds or 1 minute and let your body stabilize, and then stand up and wait for another 30 seconds before you start taking steps to go to the bathroom. That way you will prevent some falls that elderly people normally experience, and they break their hip bones, and many of them die from there. I know a few people who fell like that, and they broke their hip bone. They did surgery to correct it, and they said the surgery was successful, and they died 2 weeks after. Quite a number of people like that. So you can prevent such falls by making sure you do the right thing. Let me conclude today by saying that when you measure your BP, normally it should follow a ratio 3:2. Systolic to diastolic should be ratio 3:2. Like 120/80 is ratio 3:2. If you divide 120 by 40, you get 3. You divide 80 by 40, you get 2. So ratio 3:2. So as the lower one and the lower one is going up, the upper one should be going up commensurately. The two of them must be coming down simultaneously, going up simultaneously. One should not be static while the other is climbing or dropping. Both should be moving together. That is better. But when you see one static and the other one fluctuating, then that is not a good idea. There was a time I had my diastolic pressure almost as close as possible to my systolic. They will measure my BP and it will be 130/110. You see, just 20 points difference between my systolic and my diastolic. The days I was struggling with my BP, that was between 1997 and the year 2000. It was a terrible situation. But today my BP fluctuates between 110/70, 120/80, and I am not on any BP medication. All I have is faith in God, and I adjusted my food and my lifestyle. So ratio 3:2, don't forget. Now, when we come back next episode, I'll be explaining the factors that drive systolic and the factors that drive diastolic, and how to interpret your blood pressure reading when it comes, as well as your pulse, as well as how to bring down your pulse if it's too high, or to help your pulse to stabilize. Don't forget, what we need is not more medication, but more education. And the best prescription is knowledge. You shall know the truth, and the truth shall set you free. My people are destroyed for lack of knowledge. Jesus says, I am the way, the truth, and the life. No man comes to the Father except by me. I welcome you into a relationship with Jesus Christ. You will never regret it. It's the best life I've ever had since I knew Jesus as a teenager up until this moment. From April 1978 till this moment, I've been walking with Jesus, and it's been doing me good. I invite you to come on this journey. It's a great life. Thank you for your time today. God bless you.
My name is Olanike Aladeshuyi, a graduate of Rafa Institute of Healthy Living, a school run by Reverend Tony Akinyemi, where we are taught how to take care of our health using basic healthy living principles. My coming into contact with the school has changed my life for the better. Prior to that time, I had been diagnosed with arthritis. I had pains all over me. I had difficulty in breathing. But since I decided to take the principles taught in the school seriously, and I followed them, I discovered that my health has improved. I am free of pain. My breathing has stabilized to such an extent that I can run a gym. Can you beat that? So, I want to invite you. Come, join us at Rafa Institute of Healthy Living. Let's learn together how to reverse supposedly irreversible diseases using nutrition and lifestyle. All are basic principles. Your life will not remain the same again.